We know many people still have a lot of questions regarding the coronavirus outbreak.
So today we have a doctor joining us to share some facts about this illness and how you can protect yourself. Joining us now is Dr. Latisha Rowe. She is a family medicine physician and founder of Rowe Docs. Thank you so much for being here with us this afternoon.
Thank you for having me.
First off, why is coronavirus spreading so rapidly?
The thing is, the virus is so new, we don't know a lot about it. So in terms of the virus spreading so quickly, I think it's because we failed to take precautions early on. Everyone thought it's just like the flu. I'll continue with my everyday life. And while that was happening, we see here in Houston, there was someone at the rodeo. He was making contact with other individuals. People are still taking trips. People are still traveling. People are still at crowded events. I think that is the main reason it's spreading so quickly.
We know the city and county has been making recommendations what folks can do. It's really our responsibility to work on our hygiene and make sure that we're not causing the spread. What can folks do to help with the spread of this virus?
I think the most important thing is we've heard over and over again, wash your hands. And typically, maybe you would only wash your hands for a few seconds. You have to wash your hands for at least 20 seconds. I wash my hands and then I use hand sanitizer after. So I think just being very cautious about washing your hands and avoiding touching your face after touching surfaces. That's one thing you can do, as well as avoiding crowded events in areas where you may come into contact with it.
We've heard a lot about patients and those who've had contact with patients isolating themselves. When is it time to self-quarantine?
I think definitely if you have traveled, you should self-quarantine. At this point, we know that that is the main mode that it has been traveling between individuals. So if you went on a trip, just go ahead. Don't wait for symptoms because it takes 9 to 14 days. You should self-quarantine. And definitely if you have come into contact with someone who has been diagnosed, then absolutely don't wait for symptoms. Don't overthink it. Just self-quarantine.
And people should call their doctor first. Call the doctor. Don't just show up to a clinic. Call first.
Absolutely. So I do telemedicine. It's where you can see a patient by video. So call your doctor. Ask your doctor if there's an option for a virtual appointment. Your insurance company most likely will cover it. Even Medicare and Medicaid have lifted previous restrictions to make sure our most vulnerable population, the elderly, has access to that as well.
All right, Dr. Rowe, we truly appreciate your insight on this afternoon. Thanks so much for coming in.
Thanks for having me.
Thank you.